Welcome back. We are now beginning another section, and in this section we'll be discussing the entire labor and comfort measures you use in labor. However, I do want to just mention before we get started that there are 6 care practices that will really help you through your labor and make it more of a normal birth. One of them is labor should begin on its own. Now, in where I work, everybody tends to think, gee, we should have the baby out in a certain day, a certain time, but it really works better when your body is able to labor on its own and to go into labor on its own. The second one is laboring women should be free to move around. And that's another point that we want to make sure that women are able to get up and move around and not tied to the bed. They don't have to be on the monitors the entire time because women labor better upright than laboring lying down. Laboring women should also feel that they have continuous support around them. And that means you guys, the nursing staff, midwives, anybody who's there to feel like their support. And there's also laboring doulas, which is a whole nother industry that we're going to talk about later. But a lot of people use labor doulas while they're in labor to help feel supported. No routine interventions during labor and delivery. And that talks about monitoring, IVs, catheters, things that we will be discussing in future sections, but that's something that we're trying to avoid now. Women should not give birth on their back. Oh, should they not give birth on their back? And I will show you how that's a problem in the next section. And the last one is mother and babies should not be separated after birth. We really want to promote, for those of you who are interested in breastfeeding, we want to make sure you have a chance to start that where a baby doesn't disappear and ends up in a nursery before you get a chance to do that. So let's get started. There are 3 stages of labor. That's a medical term. When you ask your physicians or you ask your midwives, what stage am I in, they will know exactly what you're talking about. Stage 1 is the total dilation of the cervix. Stage 1, you remember this from the last time, stage 1. Stage 2, baby comes out. Stage 2, baby comes out. Stage 3, the placenta comes out. But in the first stage of labor, your labor changes 3 times. So hence the reason why we have this chart again, is the 3 phases. And we measure them by cervical change. So in the first phase of labor, your cervix opens from 1 to 3 centimeters. In your second phase, active phase, that's when the cervix opens from 4 to 8. And the last phase is 8 to 10, which we call transition. And I'm going to go over each phase because these are the ones that tell you, gee, am I in labor? Is this what's happening? And very specific things happen in each phase of labor. So I'm going to go into them with great detail. All right, so the first phase of labor is defined when the cervix opens from 1 to 3 centimeters, the first 3 circles. However, since you're not examining yourselves at home, right, ladies? We're not leave that to the professionals, please. I once had a dad pull me aside in class and said, if I just put a pair of gloves on and would I know what I'm feeling? Keep your fingers out of there, step away from the woman, okay? This is not something you're doing at home. However, since we don't know what your cervix is doing, we have to go on what your contractions are doing. So anywhere between 5 and 20 minutes is totally fine, and each contraction is only lasting 30 to 45 seconds in length. Now, as I said earlier, you know, sometimes women don't realize it right away they're in labor. You know, it may take a few hours to figure out, is this it? However, the first rule of the early phase of labor is don't start timing your contractions until they start bothering you. Because if you wake up at 3 in the morning saying, this is it, honey, wake up, this is it. And you kind of groggily say, how often are they coming? You're timing them? Yes, they're coming every 25 minutes apart. If you're measuring them at every 25 minutes apart, that means that you've now lost 24 minutes of sleep. So you don't want to be doing that. When they stop bothering you, that's when you start paying attention. That's my first rule. Second rule of the early phase of labor, when they stop bothering you, stop eating solid foods. What are you allowed to have? Clear liquids. What's a clear liquid? You pour it into a glass, you hold it to the light, you see through it, you can drink it. That's a clear liquid. Clear liquids, ladies, consist of tea, broth, Jell-O is considered clear liquid, any juice you can see through, any soda you can see through. What juices can you see through? Think about this for a second. What juices?
Apple juice.
Apple juice. What else?
Grape juice.
Grape juice. White grape juice. Dark grape juice is hard. Cranberry juice. Those are all fine. All right? Why do we put you on a clear liquid diet in this phase, ladies? Is because a lot of you feel just fine in this phase. It's this phase when some of you start feeling nauseous. And if you decide to eat pancakes in this phase, we're all going to see it again in this phase when you bring it back up. Okay? So keep it clear. Gentlemen, your clear liquids are gin, vodka, beer, wine. There's a whole liquor cabinet full of clear liquids just for you. Honey, can I just have a shot of Stoli on the way out of here? Yeah, sure. Okay. All right, so clear liquids, because we don't want the stomach getting too upset. Now, we don't want you to stop eating completely. And if the labor is going a long way, then you just have to nourish yourself, because you can't. It's like running a marathon without eating. You need to get something for yourselves. So, liquids. The third rule is keep yourselves busy. This is the longest phase of labor. It's also the least painful phase of labor. So, for example, what do people do to keep busy? Well, you go shopping, you get your nails done, you pack and unpack your suitcase a gazillion times, you take your shower, you shave your legs, of course. Gosh forbid you should show up at the hospital with your legs hairy. You know, stuff like that you need to take care of. Now, this is the phase when, this was really when the ladies have a hard time, is when I tell the partners this is the phase she needs you the least. What does that mean? That means she calls you on the phone and says, Joe, I think this is it. And honey, I have about 15 more minutes of work here. Can I get that done? No, I want you home now. However, if you can clear the desk, make the phone calls, tie up the loose ends, and in your case, you got to get your first one situated, you know? So when you have a child at home, this is your chance to get the first one organized, whether it be they're dropping them off at a neighbor or your mother's coming to stay, but this is what you need to do. So that's the first phase of labor. I know as you're walking out of here today, you're going to say to your spouse, honey, ignore what she says about that early phase of labor. When I say come home now, you come home now, because you don't want to be arguing about this over a big deal here. So as far as the early phase of labor, this is a time for you gentlemen, for you coaches, to actually take care of yourselves. You're allowed to eat, go to the bathroom, take care of business. I've seen more men who didn't get those opportunities to do that, standing by the bedside, no joking, she's on the bed in the hospital, and he's like this, can I just go pee? No, you don't even want him going to the bathroom. I mean, that's how much you really want him to be there. So let him take care of himself, let him have that food, just don't eat in front of the wives, that's not fair, okay? So the first phase of labor takes about 10 to 12 hours. So that's the longest phase. So that's why we say keep yourselves busy. Knock everything I say in half, my dear, okay? Because it's not 10 to 12 for a second timer. It's much sooner than that. All right, so at the end of this phase of labor, you pick up the phone, you call your doc, and he or she says, or your midwife, and says, yeah, it sounds like you're in labor. You really sound uncomfortable. Why don't you come in? So you get to the hospital, you get to your birthing center, and we lie you down and we examine you for the first time, and here's where your memory's going to help. You're 100%. minus 2 and 3. Ooh, she's 100% minus 2 and 3. Okay, who remembers what 100% is?
Effacement.
Effacement, outstanding, that's the thinning out. Okay, what's minus 2?
Pelvic station.
Pelvic station, minus 2 is pelvic station. And the third thing, what's 3? Dilation. Outstanding. So we have a cervix that's 3 centimeters, 100% effaced, and minus 2 station. It's a great beginning for a first timer. I have a feeling, Chris, you're going to be walking in a lot later than that, okay? Just because of the nature of second timers move faster. But this is a great beginning. But it's not enough yet to lie down over. It's not enough where you think, gee, I can't stand this anymore and I need to lie down. So what we tend to do is send women walking. It's one of our favorite activities in labor. Why? Because walking creates what? Give me the word.
Gravity.
Gravity. Gravity. Because when you stand up, baby goes down. Okay, so for the first hour of the walk, she's perfectly fine. Handling everything just swimmingly. It's the second hour that you start noticing the change in attitude. I know they want me to walk, but this is killing me. Listen, honey, pay attention, pay attention. I want to go home now. I want to go home now. Are you listening to me? I want to go home now. When your wives start making no sense whatsoever, it's time you're entering into the active phase of labor. There's something else that happens to some women. Women who have never whined in their lives start, oh boy. So it's hard for people to listen to that. But that's what they want. The whining happens big time in this phase of labor. The active phase of labor is defined when the cervix opens from 4 centimeters all the way to 8 centimeters. The contractions are coming every 2 to 3 minutes apart, lasting a whole minute in length. George, remind me, how do we measure contractions from what to what?
To the start to the start.
From start to start. Beautiful. Okay, Lisa's like, oh my gosh, George. All right, so tell me, If her contractions are coming every 2 minutes from start to start, and each contraction is lasting a minute, so just look at this. So from start to start 2, 1 minute on, what's your downtime?
Wow, it's like what? Not even a minute.
There we go, we got it, 1 minute. Do you know how many men get this wrong? I was like, I go 2, 3, they forget what I'm asking. 1, 2. 1 minute on, 1 minute off. That really changes the nature of your labor. So for those of you who have sort of been breezing up to this point, you're really starting to begin to feel it. And you're getting a little nervous because you're thinking, gosh, I don't think I can handle this. But you can. Because your body's okay. It's okay. This is normal. And remember, that downtime, there's no pain. And that's the hard part. It's like, okay, knowing I'm going to get another contraction, but I think I'm going to be okay. All right. So let me just show you the baby because I didn't show you that before. This was the baby from early labor. All right, now look at this picture, okay? Now maybe I should do this back. Oh, no, this is good. Tell me, what's changed in the cervix, okay? Because that's usually the first thing that people notice in this picture. All right, let me show you the picture before because then it will make more sense to you. All right. Okay, so this was the picture with the baby, okay? Right, okay, so George, I already heard it. All right, so what's different in this picture? What's missing? What's missing? Mucus plug. The mucus plug's missing in this picture. And what happened to the cervix? Look at how long it is here. It's thinned out. There's the effacement. I think that's a hard concept for people to understand when they start talking about it, but now you can see where it's long here and it's short here, and it's all thinned out and moved up against the baby. And there's about 1 centimeter in dilation. That's the early labor picture. Now, with active labor, lots of things happen. In most institutions, they start deciding whether they're going to keep you. They're going to admit you to their hospitals. In birthing centers, it's like, let's see how she's doing. Let's see if we need to really deal with her right now. So you may be even further than that. And if you're dealing with a home birth, this is when things start getting a little more difficult, and that's where you really need a lot of support around you and tell you that your comfort measures are right there. And we're going to talk about comfort measures at the end, but this is the phase of labor that most people are looking for a lot of comfort measures because it's getting more difficult, all right? One thing that this medical institutions like to do at this point is thinking about the water breaking. If the water hasn't broken spontaneously, sometimes the doctors would like to do that. Now, here's our baby from our active labor picture. All right, you can see the cervix is getting a little bit bigger, and there's that little bag of water at the bottom. You see that little spot of water right here? Okay. Now, the thinking behind breaking the water artificially is if we break the water, what's going to happen to the baby's head? It's going to move down. It's going to move down. Gravity. Okay. But what we found is the reason why the water exists in the first place is it makes it more comfortable for the mothers because that cushion is the cushion against the cervix. So it's more comfortable. The mothers aren't as much pain. They handle it better, and they labor much nicer. So there's no reason, there's no medical reason to go in there and break that water. Now, I should take that back. There's no just for the I don't know, oh, let's just for the heck of it break her water. That's not where you want to be. You want to have a medical reason. If they're going to break your water, you should have a medical reason. I'll explain what they are in a minute. But let me just show you what I'm going to talk about. This is an amni hook. All right, I'm going to pass this around so you guys can take a peek. It looks like a crochet needle. It has a little hooky thingy on the end. We go in, we call it tagging the bag, and out comes the fluid in front of the baby's head. Kind of frightening looking when you first see it. However, Roger, you just can pass it over to Guillermo when you have a chance. Good. So everybody, thank you. So you can see what that is. But I will tell you, when people see that thing coming at them, they start thinking horrible things. Like, you know, is it, the funniest questions I've gotten in my classes is, does it scratch the baby's head when they go in? And I'm thinking, oh yeah, we go up as hard as we can and let's see if we can, you know, make a few marks up there. No, that's not how we do this, all right? So this is, you know, we do this, it's a quick little tick and all comes the water in front of the baby. But my second favorite question is, do they use the same amni hook on everybody? Yes, we walk down the hall, break her water in my back pocket, break her water, break my back pocket, no, we don't, okay? So we don't use the same amni hook. This is a throwaway item, okay? Disposable item. So you may or may not see this, but I will tell you that if anyone's talking about breaking your water, ask them why. Why do you want to break my water? The medical reasons would be is if the heart rate on the baby was not doing well. Then we need to know what color was the fluid, correct? Because if it's green, we know there may be a problem in there. So that would be one medical reason to break your water. Another is if the labor is just so slow. And I'm talking about a day's worth of labor when you say, okay, enough's enough. You know, when is this going to happen? that would be totally acceptable for someone to break your water. But just because the heck of it, let's break your water, it used to be believed that if we break your water, it speeds things up. It may, but what it does is it causes more pain because that cushion that existed on the cervix is gone. So this is why when women would get their water broken, I'd walk back in and they were a different woman. Before they're like, hi, how are you? This looks great. And then we break the water. What the heck did you do to me? Changes the whole nature of the labor. So breaking of the water is not that popular anymore. So I would not recommend it unless it's absolutely necessary. So what else happens in the active phase of labor is bloody show. Let me tell you a little about bloody show. So we're still in this phase of labor. Bloody show is a continuation of the mucus plug. Little bloody, little mucusy. It's not a hemorrhage. It's not down the leg and all over the carpets. It's just a little clumpy bloody mucus. It sits inside the underwear. Okay, it's not pretty, but what it tells us is that the cervix is opening. Now, for someone like you, Chris, who may have a faster labor than the rest of the crowd, when you see bloody show, your cervix is easily 4 to 5 centimeters. So I'm going to give you a little saying I have. Bloody show, time to go. Okay? If you're sitting at home and you're thinking, everything's fine, I feel good, no problem. I bet you that's where your mother figured it out because believe me, if it wasn't bothering her, that's something that you sort of notice and go, ooh, what's that mean? So if you see bloody show, your cervix is opening. And this is when most women feel more comfortable being in their setting where they're going to deliver their babies. All right? So bloody show, time to go. Another thing that happens in this phase of labor is nausea and vomiting. And I hate to put this out there, but for women who have a propensity towards nausea in in pregnancy, they get it in labor as well. If you haven't had one nauseous day your entire pregnancy, you probably won't be nauseous in labor. But I hate to say this, but some medications take that away, all right? But nausea is not a pleasant thing to have in labor. You don't want to be in pain and throwing up at the same time, okay? So active labor is a little daunting for some, but what I need to get across to you gentlemen is being the support person means that if she asks you for something like, I want ice chips and I want you to rub my toes and where's that washcloth for my face, that's what you're there for. But I want to warn you that some of you ladies tend to go into a Jekyll and Hyde mode as well, all right? So they sort of ask for something and then go, no, don't do that. And go, no, don't touch me there. And, you know, you're not sure what you're supposed to be doing because you think you're being the best supporter, and you are. But they're very back and forth on this. So it can be difficult at moments, but then you think, okay, what's making you feel more comfortable? Well, speaking of more comfortable, this is my favorite little friend called the birthing ball. And this has really come into play a lot in the last 4 or 5 years in birthing. And because women experience a tremendous amount of back pain in labor, and we used to call it back labor. In fact, in my last Lamaze conference, that got blown out of the water. It used to be believed, let me explain this, when a baby's coming down into the pelvis, it's supposed to be facing the spine or facing the side. But in 1 in 5 women, we get a baby who's facing up. It's called the sunny side up position, which allows the back of the head to start smacking into your spine. Okay, so we don't know who those ladies are, but one of the last research things that we've found was that back pain happens no matter where the baby's located. So it's not always associated with fetal position. Now, we had talked about fetal position before, and getting a baby into the pelvis. One of the things that women love to do when they're pregnant is what all of you are doing right now, is leaning back on a couch like this. Yep, that's how we sit. Yes, this is the most comfortable I've been. This is how it works. But truly, when you sit like this, your baby, who's trying to reach and get into the pelvis, it starts hitting the pelvis this way and can't seem to breach that bone in front. So one of the things that some people do is they sort of lean forward, or you take a chair, turn it around, and lean over the back of the chair. And I'm going to show that to you later. It's a really comfortable position. It also allows the coaches, the guys, the supporters to put their fingers in the back and hold the back and squeeze the hips and make you feel a little bit better. But one of the things that's really cool about this thing is when you sit on it, your pelvis goes really wide. And that's exactly what you need to do to get a baby into the pelvis. Now, it's like squatting. It's just that some women may not have the ability to squat because their legs get tired. I mean, this is not something we do in this country, a squat. So when you sit on a birthing ball like this, you can't tense up your rear end, and you get to sit here and you go, you know what, this is cool. And we were talking a little bit about bouncing. Bouncing, oh my goodness, you see women bounce on this thing all the time. Now, being pregnant, of course, I don't have the pregnant belly. You may feel a little unstable. This is why you got someone watching you from behind, watching you on the side, just to make sure you don't fall off the birthing ball. We don't want you falling off the birthing ball. But it really makes you labor, makes those contractions just a little bit more tolerable, a little bit easier. Staying upright, getting in this position, letting the baby move down. Does that make sense to everybody? Because the birthing ball is my favorite. Some birthing centers have them all the time. Hospitals sometimes hold them in their labor and delivery units, and some never have it. So if you're interested in doing this, get one ahead of time. They're in all the sports stores these days, and they're like Pilates balls. You see them all the time in gyms. Work great. Just make sure you get big enough so that your knees are not sort of sitting up by your ears when you sit on it, okay? So you don't want it too low. So that's the birthing ball. So ladies, this is not a particularly great phase of labor for you because you now understand what's going on. You understand that this is painful and I don't know if I can do this, and you start losing sort of that confidence that I can't do this, but you can. You really can do this. And so just so you know that you may go through many different parts of this phase where you're like, I feel good, and then I'm not feeling so good. I don't know if I can do this, and I'm getting scared, and I want to go home. I don't know how many times I must have heard that out of a woman's mouth. I want to go home now. One of my favorite stories, this is a true story. I'm walking down the hallway of labor and delivery, and I hear this whole conversation going on in the room. Honey, I want to go home now. Voice of reason. We are here, IV's in, we're having the baby today. Don't talk like that, we're having the baby. I know all that, but maybe we missed this part in childbirth class. Maybe we're supposed to go home now. So go ask the nurse. Go ask the nurse. I'm not going to ask the nurse. She'll think I'm an idiot. Are you kidding? I'm not going out there. For me. Go ask the nurse for me. So the poor guy comes out like this. Okay, are we supposed to go home now? I'm like, get back in that room. In one ear, out the other. Don't pay attention. Because that's the phase when you start making no sense. But my funniest thing as a labor nurse seeing in this phase is your loss of modesty. And oh boy, ladies, if you think you're modest, wait until you see what you do next. Because absolute out the window. You usually start off feeling warm. You know, I'm kind of warm. Honey, I'm really hot. Could you please just fan me? Just fan me. That's better. Listen, is the air conditioning on? Is it? Can we crank it up? I need a little higher for me because I'm really sweating here. Okay, can the window open? Because I'd like to get a breeze off the... It can't open? What do they think I'm doing? Going to jump out of the window? Why can't the window open? Okay, listen. All I'm wearing is a New York hospital nightgown, a hospital nightgown, and I'm wearing a gown and a sheet. And you know what? I have to get rid of the sheet now. Sheet's gone. All that's left is a nightgown and 2 monitor belts, no panties, no bra. And she's, oh, I think if I have to, rips off the nightgown, now she's naked. And if I tell you the husbands are complete, you're naked. Anybody can walk in here, you're naked. I really don't care, to tell you the truth. I could care less if I'm naked right now. All I know is I need air. So the interesting part for my job is watching this happen and think, okay, that's great. But the funny part is you think it's supposed to come back, this modesty? Nope. After you deliver, it's just as bad. True story. Walking into one of my Lamaze couples' rooms after they delivered, I'm a lactation consultant, so I'm checking in on the breastfeeding. I'm knocking on the door to give her some warning. Knock, knock, come on in. I could have been the guy selling the paper. Come on in. I had no idea what I was walking into. Come on in. I walk in. She's on her bed, cross-legged, breastfeeding the baby with nothing on but bikini undies and a pad in there. It was a pretty sight. It was a pretty sight. Baby's on that breast. She's sitting there. I go, hi, Suze. How you doing? Sherry, it's so nice to see you. How'd everything go? Oh, everything went so well. Labor go well? Yes, yes, yes. And your husband? Wonderful. Breastfeeding? Great. Now, at that point, it was a private room. There's usually a husband that I knew from class that would jump up, shake my hand, give me a hug. I knew these people, right? Well, there was a man in the corner, but he wasn't jumping up. So then I'd look over, and she says, oh, Sherry, I'm sorry. I didn't introduce you to my father-in-law, Joseph. Okay, quick visual. Breastfeeding naked in front of your father-in-law. Do you see yourself doing this? Because I didn't, okay? So I thought I was on candid camera. I'm like, okay, who's watching me? Who's watching me? Because I am really embarrassed now. I've turned every color of the rainbow. And hi, nice to meet. I'm thinking, this is weird. So when you find yourself breastfeeding naked in front of your father-in-law, you will remember this conversation because you end up losing that modesty and it doesn't come back. It doesn't come back. So that second phase of labor can last 4 to 6 hours. Chris, 2 to 3. Okay? So this phase of labor, 4 to 6 hours. And just when you think it's really bad, it gets worse. And the last phase of labor is called transition. And transition is when the cervix opens from 8 to 10 centimeters. The contractions are coming every 60 to 90 seconds and lasting 60 to 90 seconds. Okay, guys, what do you think? Do we get a break between contractions when they're coming every 60 to 90 and they're lasting 60 to 90? No. It's one on top of the next, on top of the next, on top of the next. And this is probably the most difficult phase for women. But the consolation prize is this phase of labor can last about 10 to 12. This one's 4 to 6, and this is 1 to 2. So it's the shortest phase of labor, but it's the most difficult phase of labor. And it's the worst, but then again, it's near the end. And the one thing that women most experience in this phase of labor is what we call the early urge to push. All right, now I know this, let me see if I get this picture properly. Here we go. Wait, let's see. I'm looking at the belly, lying down. Okay, here we go. Now I got a picture here for you. All right. Women get an urge to push. Looking at this picture, why would a woman get an unbelievable urge to bear down? I need to bear down, push that baby out. Why? What's going on? Where's the baby's head?
Coming out.
Where's it sitting? Where's it sitting? On what part of your body? The bowel, in the bowel. It's sitting in the rectum, making you feel like you have to push something out. Look at that bowel. It's skinny, skinny, skinny. So everything is pushing down here. So what do we do about that? And why is this a problem? Well, for first-timers, if you get an urge to push, the problem is the cervix is still probably about 8 or 9 centimeters. So we've got a cervix that's still in front of the baby's head. That's a problem. Because if you bear down, if your body says, push, 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 and you start bearing down, you may smack that kid's head right into the cervix. And if I come over, Roger, I come over and I punch you in the eye with the strongest fist I've got. What's going to happen to your eye?
Gonna bruise.
And keep going with me here. Okay, it's going to get swollen. And if you get swollen, the cervix gets swollen. And if it swells up, then that wonderful 8-centimeter cervix is going back to 6. And we don't want that happening. Okay? So urge to push, blow it away. Just before someone comes in and examines you, we don't know if you're fully dilated. We don't know if you're there yet. So let's just take it and say, you know what? I've got an urge to push. I better blow. I want you to picture a big birthday candle with lots of candles on it, big birthday cake with lots of candles on it, and we're going to blow like our life depended on it. I know it looks silly, but it works. Urge to push, blow it away. Urge to push, blow it away. It's really important that you do that. The staff watches you like hawks. Let me tell you, anyone working with you, they can see it coming because you ladies are so subtle about your pushing. You know you're not supposed to do it. They tell you not to do it, but you still do it. This is what one of my friends did this. I was watching her, I'm like, okay, come on, Lynn, keep going, Lynn, doing great, Lynn. And she's like this. Lynn, are you pushing? Open your mouth and blow. I don't want to do this anymore. Urge to push, blow it away. Now, for those of you out there who are thinking of taking medication, I want you to know in this phase of labor, you won't get the urge to push because that epidural comes out in about halfway through. However, if you do have an epidural at this phase, you will get what we call rectal pressure. Let me show you what that looks like. You've been pain-free on the bed for hours, and all of a sudden you see you're doing this. Honey, what's the matter? I'm having a lot of rectal pressure all of a sudden. What do you think that means? Oh, the baby's head's coming down, right? That's a good sign. Yes, yes, yes. Okay, nurse, I'm having a lot of rectal pressure. Can we up that epidural and take that away? We can't? Doctor, I'm having a lot of rectal pressure. It's really bothering me. Baby's moving down. I know it's a good sign, but can we take that away with the epidural? We can't? Are you the medical student? I've got rectal pressure. Let's just say you want to share it with everybody, because this is the first discomfort you have truly felt in hours, and I think that's what's a little bit daunting for mothers is like, oh my gosh. But as I'll bring up in the next segment when it comes to pushing, you really do want some pressure. You want to work with something because it's a hard sell to tell mothers to push if they can't feel anything. Now, epidurals definitely have their pros, but their biggest con is that you can't feel to push, and that's where it gets hard for the mothers. So my job is to make sure, yeah, the epidural's okay, but it's better if you don't have it or you don't have that feeling that you can't feel anything because then we're going to have trouble getting that baby out. So Urge to push is really important. Now, coaches, let's just review your jobs, the men in the room. So the first phase of labor, you're taking care of yourselves. That's what we discussed earlier. Second phase, you take care of her. And the third phase, just be there, aloha. Sometimes we tell you guys, don't do anything. Just the nature of you standing in the room is all she wants, just to know that she is being supported. However, some of you don't think that's just good enough. You feel you need to contribute your thinking along the way. So some of the things that come out of your mouth are just hilarious, like, you look beautiful. You look beautiful. You ladies are sweating buckets and you're not pretty right now. So you look, or my other favorite, I love you so much, if I could take the pain from you, I would. Liar, liar, pants on fire. And my favorite of all, and this is true, I walked into a room once, her knees were up, her legs were apart, and the guy is shouting into his wife's vagina. Look for the light now, aim for the light. What are you doing? I'm giving my child some direction. Aim for the, and all I kept thinking was, oh, thank goodness, she married him and got him off the market. Unbelievable. Aim for the light. Aim for the light. Anyway, when your care person comes in and gives you the good news that you are fully dilated, 10 centimeters, cervix is out of the way, when my doctor told me that, I wanted to jump off the bed and click my heels in the air, because you feel so accomplished that you got somewhere here. That first stage of labor, done, finished. Next stage, we're going to push that baby out. All right? So that is the first stage of labor. Do you have any questions? Do you have any questions about the first stage of labor? Stephanie?
At what point do we get the epidural?
At what point do you get the epidural? Here I am trying to teach about natural labor, and oh well, no. Most people ask for it sometime between 4 and 8 centimeters, and that's usually the best time to take it as far as we're concerned. But we're going to talk more about drugs in a minute. Roger?
And are there risks involved?
Are there any risks involved with the epidural? Can we hold that one until a section at the end, because we will be discussing all the questions on epidurals and medication. Any other question? Lisa?
Yes, earlier you mentioned a labor doula. What do they do?
A labor doula. Labor doulas are a profession that has become really, really popular all over the country. And there have been a lot of studies that are done talking about the support that you need in labor. And outside your husbands, your partners, your spouses, you have a person who can come in and really do what they need to do. And that is massage you, walk you through the problems of labor, and really, really support you. And it's not that we push the husbands aside on this, it's just one more person supporting you. And they have all the techniques and they have all the comfort measures in their bag of tricks, and they get you a lot further along in your labor than you would imagine. They did a fantastic study out of Texas a long time ago, and they took a whole bunch of labor doulas and they put them on a floor and just randomly assigned them to patients. No one had ever met them before. And that hospital had a very high cesarean section rate, and within a month, they dropped from 32% to 16%. So just by the nature of having someone else supporting you made all the difference in the world. And it was a huge research, it was a huge study, and people really paid attention. So all of a sudden, now there's this new profession called labor doulas. And if you're planning on trying to do this without medication, I really strongly recommend using one, because they really help you do the things you would normally. And it takes a lot of the pressure off the dads, because then they don't feel like they have to be the ones with all the answers. Because I think that's where you feel like you're, oh gosh, how am I, in charge here? And then you're not. Thank you. It's a great question. Does anybody else have any questions? Rhodey?
When does the doctor show up to the hospital?
When does the doctor show up at the hospital? Well, it really depends on your practice, but most docs show up in active labor. That's when most of them come in, because that's when things start getting a little bit more difficult for the moms. So if you're planning on medication, the doctor can't, you have to have the doctor there to get the medication. So that's usually it. So I would say somewhere in active labor that they usually come in. Okay. Are there any other questions? Great. The next section we're going to talk about is labor comforts, or comforts in labor that you need. And I have a wonderful little chair here that I'm going to show you. Now, what's great about turning a chair around is that it really widens the pelvis, and you can lean forward, and it really, really helps the baby move into range. What's also nice is when you've got your partner behind you, and if you've got some hip issues, if you're getting pain in your hips, we call it the double squeeze, which means you just basically grab the hips and you just squeeze it, and it makes the women feel really wonderful. So if there's a chair in the room that doesn't have any arms, make sure you turn it around and hang over the back of it. At home, this is a great comfort measure as well, so that when you're still starting your labor and you're not comfortable and you're trying to find a comfortable position, try a chair without arms. It really may make a difference for you, okay? Okay, and there's some other comfort measures that I want to go over with. And we're going to use Chris and Peter in this. So I've got some pillows, and we're going to have you, so Peter, you're going to actually stay on the couch, and Chris is going to come down. So come on down. You're going to scooch over a little bit, Peter, because I'm going to put these pillows this way. Chris, come on down. There we go. All right, now I'm going to put the pillows right between your legs. I'm going to put 2 pillows here. All right, take a seat, darling. All right. And because everybody likes to have their knees up and supported, we're going to put 2 pillows underneath. Hold on. Got one more. Can you get the legs up? Whee! Yeah, yes. And now we've got someone behind you, someone in front. We've got all that support because part of your body wants to be supported. And being upright, once again, we're working with gravity. Okay? And then we've got the husband who's going to be doing some nice massaging of the shoulders. Isn't that something? All right, so this is a position that really works very nicely. And I think that once you say, okay, this works, and now this isn't working, so I'm going to turn over and put my pillows between my legs. A lot of these institutions don't have a lot of pillows, so make sure, I know it's one more bag to carry, but I do recommend carrying in 2 pillows from home. And if you're planning on breastfeeding, those pillows will really come in handy. Other comfort measures that are available to women is hydrotherapy, which means tubs, showers. I often find that women say, well, why would I want to go into a shower? Simple. When does a shower not feel great? I mean, when does a shower not feel great? So women relax in showers, they let your body relax, and everything sort of moves faster. I once worked with a midwife who put a woman in a shower at 4 centimeters and said to her, don't come out until you're crawling. And she literally was like crawling out at 8 centimeters. I mean, in hours, she went from 4 to 8. So showers really work. Tubs really work. You're going to a birthing center that has a tub, so use it. It's fantastic. Women feel buoyant. They feel great. Also, ice packs help. Sometimes heating pads help. Whatever a woman feels that she needs that makes her feel better, that's what you want to use, all right? So having extra pillows, hydrotherapy, which means being in a tub or being in a shower, the double hip squeeze, which I talked about before, when you're sitting over a chair, you squeeze it. Sometimes it really helps. If it hurts, this is what feels better. Okay, so the next position I want to show you is a position when you're having back pain in labor. So come on down, and I want you to get into all 4s. There we go, face me. Great. Because when you've got a baby sitting on your back, it's going to be really uncomfortable for you. And so by getting into this position, where are you sending your baby? You're sending your baby down, gravity. You got your baby in the belly, and that makes it feel so much better. Also, you guys can also get there and massage your back too if it's really bothering. Or once again, you grab the hips because that makes you feel really good. So this all 4s, lots of people use this in labor, especially those who are suffering from back pain in labor. Thank you. Okay, so we got you guys getting back ready. Great. Does anyone have any questions concerning the labor, comforts? Anything else? Stephanie?
The all 4s, I know you said it was good during labor. Can you use that at any point during your pregnancy for back pain?
Absolutely. I remember one specific time when I was pregnant, I got up and went, uh-oh, and I felt sciatica all the way down the back of my leg and from my rear end all the way down. And I'm thinking, no, not me, because I'd heard so much about it, I didn't want it. And when you get on all 4s, you get your baby off your spine. Not only do you get your baby off your back, but you get your baby off your spine, and all of those little nerve endings aren't going to be affected as well. So if you're having trouble now in your pregnancy, this is a yoga move. You just sort of, arch it and bring it back and just give yourself a little bit of breathing space here back here because it's going to make you feel better. And if it does, fabulous. We've just corrected a big problem. All right? Okay, so we have just completed another segment. We've covered the labor and the comfort measures.